Hi guys, very good afternoon to you and welcome to one of our amazing seminar days with our fantastic demand and capacity team. We've got the wonderful Keith, Paul and Edwin here with us this afternoon. This is a bit of a pre-recorded session for you, which is summarising a live session that we did earlier in the day. So the aim of the session is to share with you some top tips from demand and capacity world, basically emerging from Covid-19 and recovery of Covid-19. So we're going to do that in three little segments, really. First of all, we're going to start with Keith, and I'm just going to take you through to some lovely pictures of ourselves here on the screen, if it will do it. I don't know if anybody can move me on with that slide. There we go. So here's your panel today. So myself and the emergency care improvement support team, and basically being bag carrier and kind of compare for these amazing individuals, Paul, Keith and Edwin. So Keith's going to kick us off with the first session for today, which is going to be top tips from the summer series of events, and just giving us some information around that. Closely followed by Paul, who's going to take an analytical approach for us and share some top tips from his analytical work. And then finally, but by no means least, we've got the wonderful Edwin, who's going to be coming at it from an improvement science point of view. And I'm just going to be, in quite a clumsy way, at the end of each segment, just maybe putting in one or two observations from a layperson's point of view. So really excited to be with the guys this afternoon. And with that, I'm going to hand over to Keith. Thank you, Keith.
Thank you very much, Paul. So we'll be talking about top tips from the summer series. You may not be aware that we've been running a bunch of webinars over the summer, covering a wide range of topics. So this is week 11 of the webinar series, if I've counted correctly. And we can see here some of the topics that we've covered to date, and there's been a real kind of depth of knowledge and experience from people who have actually been doing the modeling and doing the really in-depth work necessary to improve their services, especially in response to the pressures that have been put on by the events of the COVID pandemic. And just go through some of the learning that we've actually picked up, some of the themes that we've picked up, heard from people who've actually been doing the actual work on the ground. So we've looked at some of the fundamentals, some of the things around how you actually get started. We've heard from specific services like diagnostics, and from community services about how they've actually looked to both restart their services and make them more robust. So taking the opportunity to actually transform their services for the long term and actually remodel them in ways that they really wanted to all along, but didn't necessarily have the momentum to do. So there was some really lovely work about how to actually implement some really transformative changes for the better for our patients and for staff. We've also heard from commissioners and also from colleagues who've been linking up the work in really interesting ways with other work streams. So, for example, linking up workforce, job planning with demand capacity, so natural synergies and being able to leverage as much value out of the really great work that's been put in. So this is just a sort of top five, really, my top 5 tips that we've actually heard, the themes that have come out that seems to have come through the experience of people. So tip number 1 is have a plan before you start, which sounds maybe a bit humdrum, but it really is absolutely key to being able to successfully implement transformative change. Having a plan and actually asking some really important questions. So the first one, what do you actually want to achieve? And that's a really key question, because without knowing that, you just end up reacting to everything. So knowing that what you actually want to be able to achieve, and then taking stock of what you have in order to get there. So how long do you have? How are you going to build on the gains that you have, that you make? And also, really importantly, can you actually do it? Is it practically achievable? There's a lot of stuff around making sure that you have kind of smart attainable goals that you can actually practically achieve. Secondly, what resources you need. So this is about looking at things like your data infrastructure, the knowledge that you have, the skill sets, and then thinking about what you might need to develop before you get started, so that you don't have to be improvising somewhere along the way. Who needs to be involved? So we'll talk about who owns the work, and who's actually implementing the work. Where's the governance going to sit on this kind of stuff? Where's the data? Who's actually going to be involved in getting that? Who's going to be checking that? And finally, yes, of course, how do you check your modeling? So there's a validation aspect, there's a scrutiny and challenge, which ties into governance. So those are really kind of useful questions that we heard people talking about, that really helped structure their work in a really, it's not a rigid way, but actually a way to really get themselves thinking about what they need, so that they don't have things that will ruin their day kind of turn up unexpectedly. So there's the last thing you want is for something like an aspect, a key aspect that throws a spanner in your transformation plan or your modeling plans, like data quality, that someone says, "Oh, I knew about that, but I hadn't really kind of thought that it would have that much impact." So it's a chance to actually think ahead and see if there's any particular sticking points that might actually throw a spanner in your modeling aspirations, and be able to preemptively plan around it or put in mitigating features, so that you can actually successfully tackle the issues of the day. So tip number 2 is know the basics. So we're not talking about anything particularly complicated here. It's just understanding what demand and capacity principles, the basic principles are. So I'm talking about just knowing what demand actually equals, and what capacity actually equals, and how you're going to measure it. And know that everyone who's actually going to be involved in the work are talking the same language. So if you can actually get those basics, then that's a really good starting point. And so some of the resources that we have on our website, our e-learning modules, and the resources on our NHS England page will give you a good starting point to actually get yourselves acquainted with the basics and work from there. So tip number 2, know your basics, and that will stand you in good stead. So as you can see from this map, there's a whole load of work which iterates around. So we talk about using a PDSA cycle, plan, do, study, act cycle, where we make the model, we check it against reality, we analyze where it's gone wrong or where it deviates from reality, why that is, and then we use that as a framework to keep iterating through. So there's a lot of work where we talk about iterating again and again. And the key thing is, if you're doing this for the first time, the first few attempts may go a bit wrong. And that's absolutely fine. In fact, we almost expect that, because if you're doing things for the first time, you're probably going to be uncovering a lot of stuff that you didn't know about. And so your assumptions may be off. And it's really important that that's not a barrier to you actually progressing forward. You need to give yourself time and space for things to go wrong, for you to find things that are going wrong and to learn from that, because that's the fundamental nature of improvement, is that things have to be going wrong in order for you to be able to improve them in the first place. So make sure that you actually give time and space, and that the expectations are that you will have the time and space to iterate and actually make things, learn from those things that don't go as you expect, and be able to improve on them. Because if the expectations are that you're going to get it right first time, every time, then you are effectively setting yourself up to fail. So give yourself space for things to go wrong and to learn from the experience. Now, tip number 4 is a bit of an odd one coming from an analyst. It's not all about the analytics. So the analytics is an important part of quantifying your demand and capacity position, but actually there's a whole load of really good stuff that comes out of the actual modeling work, and fundamentally it's about informing decision makers about how they can proceed with improving their service. So the analytics is one part of it, but there's a lot of teamwork. So here we've actually got just some actual quotes from the presentations that we've had to date, which just talk about some of the outcomes, some of the achievements that were really valued by the teams that were working. So we had great team and multidisciplinary working, collaborative working with other clinical departments, working towards a shared purpose, having comfortable and open discussions, working things into business as usual, improved health and well-being, and this is for patients as well as staff, and looking at it's a team effort, finding where your operational processes don't fit with your assumptions, and likewise for things like past configurations and data systems, and also looking at your check and challenge and making them robust. Those are really good outcomes, because that means that you can have more confidence in what you're actually putting out, and your senior leadership will have more confidence in the processes that are in place, because you have a more resilient system. So this is the actual whole process. It is a process, and it's about people working together to make things work better. So it's not just about the analytics. And if you think that it's just going to be about filling in a spreadsheet, actually that's a small part of the overall process. And there's actually a lot of work that you have to build in before that. So tip number 5 is perhaps my favorite one, is make some friends. So I mentioned that there's a lot of team working, and there's a chance here to get in touch with your peer organizations, and we've seen this. It's been great, actually, this summer series, because we've been able to see peer organizations getting in touch with each other, learning from each other, and sharing their experiences and saying, this worked really well. And this is a really great opportunity to do that. And you can really learn a lot from each other. And there's a lot of really deep operational knowledge out there, which is fantastic to see. And the best thing that we can have is to actually get hold of that incredibly valuable knowledge and spread it as far as possible amongst the community. So amongst peer organizations, there's a chance to share learning and experiences, and also without actually your organizational sphere. So whether you're a provider, a commissioner, regional body, there's a chance to also link up with other organizations, providers, regional commissioning bodies, that you wouldn't normally work with, to get a different perspective. And this means that, if you're working at a really operational level, for example, you might have a chance to see what kind of information flows are going on at a more strategic level and get insight and intelligence that might help you plan better, and vice versa. If you're working at a really strategic level, you get some really good on the ground level knowledge about what's actually going on, and get some real insight into the real provider environment. And that can only help make your decision making better, and that's something that we've actually heard and seen from a lot of our presenters in the last few weeks. And of course, there's us at NHS England and Improvement, people like Paul, colleagues who are working in national bodies. We're also available for resources and advice. So get in touch with us, and we're always happy to have a chat about and provide some advice about any kind of questions you might have. So a big part of your success will be these relationships that you build, because once again, that just means that you have that much more depth of knowledge, experience, and expertise to draw upon, and that will hopefully make your journey that much easier. So, Paul, I don't know if you want to come in at this point.
Keith, thank you. So a really kind of powerful overview of the top tips there, and colleagues, I'd advise you to get a hold of these slides and probably print them off and reread them a few times, just so some of this stuff can actually soak into your neurological DNA. Because at the end of the day, we want to be able to remember this stuff and take it to the shop floor and make kind of frontline improvements. And that's, for me, Keith, is one of the great strengths of what you guys bring to this. So you're bringing the science, and it is a science, that is capacity and demand. But you're taking it to an operational frontline level where you're using the model of improvement, which is one of the most powerful things we can use internationally, universally, to bring about demonstrable change. So that's absolutely fantastic. I think there's just a couple of key things that I'm getting out of your session there, Keith. I think the first thing is this focus about looking at the work to be done, if you like. What's the demand on your service, and what's the capacity you might need to achieve that? And of course, way back many months ago, when I first sat in with one of your amazing kind of sessions, I think train the trainer sessions, I think I sat in on. You go to great lengths as a team to kind of discuss the difference between capacity and demand. And I think for me, operationally, of course, there's another subtle difference as well, and that's around the work that the service is undertaking may not be completely aligned to the specification of what the service was set up to do. So there is that kind of differential as well, and a little phrase of right work in terms of what proportion of your current activity matches not only the demand on the service, but the demand on the service specification that it was set up to deliver, or versus that kind of work that might need to be done by another clinical service or a corporate service. So that's fantastic. I think the key thing for me as well, just finally on your session, Keith, was this kind of permission to fail thing, but it's not permission to fail, it's permission to learn. And that's quite rare, really. And you know, I think nobody likes failing, but if you adopt the mindset of learning through plan, do, study, act cycles, you're going to organically grow sustainable improvement and solutions on the shop floor. So again, you know, colleagues, I can't emphasise enough how that's so important for our frontline teams. So that's an amazing approach. So Keith, thank you very much indeed for that. And without further ado, I'll move swiftly on to the wonderful Paul Bullard sitting there, who's going to take us through the analytical approach. Over to you, Paul.
Thank you very much, other Paul. Yes, so these are just some of my kind of top tips from an analytical point of view, things that I wish that I had known in my previous life as a performance analyst when looking at demand and capacity planning. So I've got a couple of bits and pieces that I'd really like to share with everyone today. So it's really important to understand what a model is and what it is not. Certainly from a kind of a data analysis point of view, quite often we're seen as a bit of a silver bullet, and the model will solve all sorts of problems and questions that that people in the organization or within the service will have. And actually that's kind of not really what a model is about. All a model is just some fancy maths. And it's really important to understand that, you know, that it's quite stupid in that way, in that it won't solve problems that you can't solve just by looking at data and by looking at the maths. And I think the person that best exemplifies this as an idea is this guy George Pelham-Box, who quite famously said all models are wrong, but some are useful. And actually, what he really means by that is that all models are wrong, but you need to work out what is importantly wrong in the models. And so that kind of leads quite nicely onto the idea that data quality is really king when doing the demand and capacity analysis. And this is quite a famous or quite a popular kind of view that people are becoming more and more aware of, that you put garbage in, you'll get garbage out. And this isn't to say that your data has to be absolutely perfect. We're never going to achieve that with the many moving parts of the of you know, any kind of healthcare service. But just understanding the limitations of the data that you're putting in, and you know, quite often we kind of say if you've put your data in and you've modeled your data, and actually it comes out and the service operational leads are kind of saying this doesn't feel about right, actually it probably isn't right, and data can only get you so far. And so again, with this kind of this idea that the silver bullet, that this model is going to solve all sorts of different problems, it's really important, and Keith did touch on it earlier, that it's really important that you understand where you need to start when you're looking at demand and capacity planning or demand and capacity modeling. And there's two approaches that generally get kind of talked about, and you have the 30,000 feet approach, where you're trying to model a really big service. You lose some of that granularity, but you're getting a nice whole encompassing view. Or the 300 feet approach, where actually you're drilling much more closely down into either sections of a service, or, you know, small parts of your organization. And there's pros and cons to both. For example, with the 30,000 feet approach, it can be really difficult to get some of that granularity out of it later. But with the 300 feet approach, is that you'll find that you'll have many models, and trying to knit them all together to get that whole kind of wide system or service view can be really difficult. So there's merits to both. What's more important is you understand what the pros and cons of each are. Another key kind of tip from an analyst perspective is to understand the relatively simple maths that happens. Certainly in the core model that us as a team have developed and have deployed, The maths is really quite straightforward. There's a couple of things that you'll need to know and understand, and that's percentiles and why they are used, what an SPC chart is and what it shows you, the parameters that are within our model, so things like non-attendance rates, removals for reasons other than treatment, and the ideal waiting list size and how it's calculated and how we use that to identify our demand and capacity balance as well. And we have resources available for all of these. Like I say, it can be quite daunting to start off with, but actually the math isn't too difficult. But you need to understand why we use them and how we use them in this way. And so, and again, linking back into kind of our data quality discussions, it's important that you don't make assumptions, but make assumptions when you need to. As I said, less than perfect data quality doesn't mean you can't do something. And we have a kind of a quartet approach to how we think the demand and capacity modeling as a project works really well, in terms of having senior leadership buying, having service leads involved, having your business intelligence, so your data analytics guys doing their bit, but then also having your critical friends, so your change and transformation team. And when you're thinking about, okay, we don't have perfect data, it's just your service leads that are going to be able to really help you understand, okay, what is the reality, what is actually happening within our service. And if you are making assumptions, possibly our least flashy section on our model is our notes tab, and it's really important you record those assumptions. If you come back to the model, 3 months or even 2 weeks later, will you be able to replicate your results? And Keith talked about making friends. I've gone a little bit further, and I've said choose your friends wisely. So as I said, this quartet approach seems to work really well in involving your data, your service, your change and transformation, and your senior leadership. But it does miss out two really important groups, who are your clinical staff, who are potentially the most affected by the outcomes of your demand capacity modeling or planning round, but also your admin and your clerical staff, who will know the ins and outs of processes really well. Quite often they're kind of a key cornerstone in teams that are doing demand and capacity planning well. So it's really important to involve those and make your friends with them as well. And then finally from me, Keith did speak about the modeling process as an iterative process, but actually I think it's really important to focus on the data collection as a really iterative process. So the basic steps are for you to get the data, to check that data with your service leads, with your clinical staff, with your admin staff. When undoubtedly they find some sort of issue with it, you can reconfigure your data pulling reports, and you fall back into the collecting the data. And this is really important, again, in terms of getting that good quality data into into a model. And that's it from me. Over to you, Paul.
Paul, thank you. Absolutely fantastic as ever. And do you know what, colleagues? I would really recommend that you click on some of the links in the slide deck. Now, I'm a really visual guy. I'm not a scientist at all. I can't get these concepts through reading lots of narrative, but the capacity and demand team have got some fantastic animated visuals, cartoon style visuals to display these content and they really bring it to life. So you'll find those on the links on the slide set. The guys use it as part of their Train the Trainer program. They're really powerful stuff. So please go and visit those links out, and it brings some of the concepts Paul's talking to life for you. So thank you for that. Paul, there's just 2 or 3 quick things that kind of jump out of your slide set for me there. And the first one is probably my favourite thing is your concept around not getting stuck in analysis paralysis. And, you know, we're surrounded by lots and lots and lots of data, questionable value in terms of information for improvement. But it doesn't have to be perfect. And your message around, you know, your data, it just needs to be good enough, and you can sense check that by talking about numbers and data and quantities with people who are working with the numbers every day to see if they recognise those kinds of values. And you know, I just think that's a really kind of empowering way to not get stuck in over analysing things, because as we all know, that holds a lot of people back from just making some simple improvements. I think from an operational perspective, my own experience, I've noticed that a lot of people measure things that are easily measurable, and some of the things we want to improve don't necessarily have data readily available in an automated way from a web report or something like that. So colleagues, not to be kind of frightened really of picking up the clipboard and a blank sheet of A4, piece of paper and a pencil and going to the shop floor and measuring the information that's only recorded on a bit of paper somewhere. It never sees the light of day in a computer, so we can't squirt it into a spreadsheet or out of a web report, but it's there, even if you have to go and physically observe it. And I think my final thing around Paul's kind of session there is we've heard quite a bit about modelling and the importance and the impact of equality and matching capacity to demand and things, but I want colleagues in operational roles to think about modelling proactively. And by that, I mean, we all go through the kind of turmoil of contractual agreements and setting our contract levels, our activity levels and our operating incomes against our quality standards and KPIs and such like. So I'd really encourage colleagues to think about how they can use demand and capacity planning as a means to make sure that they are set up properly for the year. And if people are talking about required activity levels under certain quality standards and key performance indicators, you've actually got the infrastructure around you to do that. And I think the work that these guys are doing here is really, really powerful in helping colleagues in operational roles to set themselves up from a contract point of view to make sure you do have the right resources in place to do what you're being asked for, because people aren't kind of shy about holding us to account for delivering against some of these targets. So please bear that in mind. It's not just something to use when you're partly through the year or you've got a flashpoint or you're worried about meeting key performance indicators. Please use it proactively as a planning tool before you start agreeing baseline budgets and contract levels and things like that. It's a really, really powerful thing. Paul, thank you very, very much indeed for that. And I'm going to move swiftly on to Edwin. Now, Edwin's going to give us his top tips from an improvement science perspective. So, Edwin, over to you.
Thank you very much, Paul. And thank you, Keith and Paul, for your great presentations. I think I'm also going to be emphasising points which are quite similar, because I think they are the fundamental points, and perhaps give you a slightly different reflection from my experience. But I think many of you will have seen this framework, the model for improvement, which is championed by the Institute of Healthcare Improvement and widely known. So you probably have come across this if you've dabbled in quality improvement. But I think it's really important to revisit this fundamental concept. Now, this approach does complement other approaches such as lean, which often comes into it with demand and capacity. But I think framing your thoughts in the model for improvement is helpful, because it gives you real crystal clarity about what you're trying to do. I think it was touched upon previously that Keith said that filling out the spreadsheet is a small part of the process. If you think about demand capacity, planning as a small part of a wider improvement effort, whether that's within your clinical specialism or even actually at the trust or organisation level, I think it kind of helps you understand that this is not just a technical exercise and a spreadsheet which will be filed away and gather dust. It's something that you need to revisit. So the first step is what are you trying to accomplish, and are you trying to reduce waiting lists, improve patient outcomes, and also the second bit is particularly important about measures, and how will you know when you've achieved when the change is an improvement. For example, if you've done the modelling and you know what your predicted COVID demand is, how do you know when you've actually met that? It might bring up issues around your data quality, that if the data quality, if the sample's too small or too poor, maybe that's your priority area. And I know, you know, having worked in a mental health trust, and just from speaking to people across the summer series who have taken time to, out of their very busy roles, whether it's clinical, operational, administrative, nowadays in NHS we can seem to have dozens of priorities. But I like to be reminded sometimes that priority, when it first came into the English language, it was a singular word. So they, in the 1400s, there was one priority, and obviously there are multiple priorities in the NHS. But I think if you can focus in your improvement approach to say, okay, we're going to do this, and it might just be improving your data quality to enable you to do the demand and capacity work better. I think that's a really good approach. So just building on that, I'll go back. I think, and this touched upon what Keith and Paul touched upon as well, which is you need to plan in time to, we all lead busy lives, but it's to revisit your demand and capacity models, to do your improvement work on a regular basis, schedule yourself reminders, put in time with key people. It's not multidisciplinary approach, but even, you know, equally importantly is, do you have the governance in place? Often what people are busy with is what leaders of, whether it's the trust or organization, dictate. So are your leaders talking about demand and capacity? Having worked with chief operating officers in the past, it can seem like their role is pretty much everything. And actually working with clinicians, there's so many different things that they could be focusing on, but it's your job to understand what other people's priorities are, and what's your organizational or trust strategy, and how does this work fit into that, because you need to get to be part of the conversation. And when I was on a board of directors for a small health charity, often those questions which are asked, and the conversations that happen outside of the meeting, if you're talking about demand and capacity with those key influencers, it's going to allow you to have that time and space which Keith talked about, to be able to carve that out, to experiment and to do these PDSA cycles. And a session for those that attended Paula's and Ricky's session in August. One of their slides reminded me of this, which is essentially something that we all recognise, that our best laid plans can go askew from the realities of life and the hurdles that come across. And I think overcoming these hurdles is to do with collaboration and working together with key people, because you know, that's the way to overcome them. And it's just being prepared for things that ruin your day, as Keith said. But I think it's about where to start. So I think doing things like process mapping, understanding where your bottlenecks are, and in previous sessions in week 3 of this series, we looked at virtual platforms such as Miro, which is free to use, and I'd encourage you all to try that. I've done that recently, and it's really helpful to collaborate virtually. And there you can start to identify where you should focus, rather than try to go across this obstacle course and just not know where you're really heading. So I think, yeah, the key point there is about collaboration. So I think, building upon that, I mean, it's been fantastic this summer series, having lots of people join, share their thoughts, contribute, to hear examples from the front line and the shop floor, as Paul said. And I think it'll be great to continue this conversation. Hopefully you're watching this now on our Future NHS platform, and I think it'd be great to continue this conversation, and to share examples of things that we're challenged with, or ideas of if we found that something works well. And we'll help facilitate that and share as many case studies that we come across as we possibly can. So do sign up if you're not already on there. And similarly, we will continue to role model and to take the PDSA approach to the tools that we offer, and training as well. So do continue to give us your feedback, and that's how we can work together to overcome some of these challenges and learn together.
Edwin, thank you so much.
I'll hand back over to you, Paul.
Edwin, thank you so much. Fantastic. Do you know what? It's absolutely brilliant to hear scientists talk about the model of improvement, which is a very basic, very kind of simple concept. So a bit tricky to operationalize sometimes, particularly in different cultures that aren't of continuous improvement mindset. But it's fantastic, and it's one of the things I love most about what you guys do, your absolute belief, and you know, the way you physically use the model of improvement. And one of the key things, well, a couple of key things just jumping out of your session for me, Edwin, is you know, the modelling of improvement is a really popular thing to use in improvers kind of circles, and there's not an awful lot of genuine kind of change agents around there, but those that are use this stuff consistently. And one of the key things I love about it most is it helps you evidence really easily whether or not the changes you make are leading to an improvement or not. And I've seen far too many fantastic ideas fall because the teams that have tested them haven't been able to evidence whether or not their great ideas have amounted to any degree of improvement. So that's one of the brilliant things I think the model of improvement does. I think the other thing around the model of improvement, once you come through your test of change into a sustainability concept, business as usual, is the measures that you work up with your team during your PDSA cycles, you can retain and you can monitor going forward and use to make sure that the guys are holding the gains with the improvements you've made. So it's not just a flash in the pan kind of concept. It's basically you've made your improvements, you've refined it through multiple plan, do, study out cycles. And you can use those measures in terms of how do you know your changes and improvement to make sure you're holding the gains, or whether or not you need to go back into a plan, do, study out cycle. I think just finally on your session, Edwin, and I love your slide where you show your improvement journey. And I think there's everybody, and I know I used to believe this, you have a plain sheet of A4 paper with half a dozen milestones, A to B, and that was you. And the world had kind of, you know, come around and make that happen for you. So it is about those deviations. And the one thing I love about that slide and the message you give with that is that you don't need to see every step in your improvement journey. You just need to see the next one or two steps in front of you and go forward with that. And I always think of it, it's a bit like driving your car home at night. You can never see from point to point your front door with your headlights, can you? You have to go around the next 400 yards before you see the next bit of the road. And that's something that you guys build into your culture and your operating practices, which is absolutely fantastic. And that's why you're so successful with helping the people that you do. So well done in that. You're an inspiration, the whole of your team there to work with. So I'd just like to thank colleagues for taking part in the session, and thank you yourselves there for being our panel members today and allowing me to compare for you. We've got some links up on the screen now that I urge all colleagues to check out, and please get in touch with the team for any kind of support or further information. It's been an absolute pleasure, guys. And just before we close off, is there anything from yourselves by way of parting comment?
Well, thank you very much, Paul. I'll start the show on this particular segment. Just do get in touch. We'd love to hear from you. We always love to hear the good work that people do, and we're super keen to spread knowledge about and share lessons as much as possible. So look forward to hearing from you all.
Yeah, from my perspective, I think it's just a reminder that people are going through the same processes that you are. So do reach out, do use the community as much as you can, because undoubtedly someone will have overcome the obstacles that you might be facing at the moment.
Yeah, and for me, I just want to agree with what you just said, Paul, as well, about taking that first step. And I know it can be daunting when you're first starting out, but once you've done that first model, I think enjoy your successes, communicate them, and I think working together to hear what other people are doing is always really positive. And I want to thank you, Paul, for hosting today. And I want to thank everyone who's attended our summer series. And yeah, do stay in touch and do continue to be part of the conversation. Thank you.
Well, guys, thank you very much indeed for what you do. Please keep it up. You're amazing at what you do, and you're fantastic in terms of how you work with the teams operationally. It's been an absolute pleasure as always working with you, and I look forward to seeing you again soon.
Thank you.
Cheers.
Thank you.